which are used in palliative care. First is pillow. Pillow, we all know, it is used on the head, neck, arm, legs, and along spine or abdomen to provide comfort. And the purpose is to maintain proper body alignment, to support body parts, and it helps also to reduce pressure. So pillow can be soft pillow or heavy pillow. The heavy pillow, which is on the right side of your screen, they are known as bolsters. So both light and heavy pillows, the selection of which type of pillow to use has to be done appropriately, because suppose we select a very heavy pillow for a patient for the head, and it will cause cervical flexion. And suppose we are using a soft pillow to give pressure to the body, it will not serve the purpose. Like we are giving pillow to prevent pressure ulcers, right? So if we give a very soft pillow, it will not serve the purpose. So backrest is used to relieve dyspnea. It is also used to promote drainage from abdominal cavity and to promote a comfortable change in position. It is used for cardiac patients and respiratory patients, and also for post-operative patients. It can be raised at an angle, and the angle can be adjusted accordingly. Now coming to bed cradle. Bed cradle are used overhead the patient's linen to keep the linens away from the patient's body. Purpose is to prevent pressure from the weight of linens. It also allows air to circulate around lower limbs, and also for privacy. In case we need to provide bedpan to the patient, it can also be used for privacy. Now coming to cardiac table, we all have seen a cardiac table. The cardiac table is an overbed table which can be used for the patient with the help of pillow, and the patient's bed can be raised to a high Fowler's position, and then the arms can be outstretched and the patient can lie in that position. So the main purpose of the overbed table or the cardiac table is that patient can rest over table with the help of pillow, and also patient can have meals. And then in that position, it helps to expand the chest and lungs to allow more oxygen to enter. This position, which is seen in the screen, is known as orthopnic position. It is used for cardiac and respiratory patients having cardiac and respiratory problems. Now coming to air and water mattresses, it provides comfort, and it's used for very thin and very obese patients and those prone to pressure sores. It is also used for chronically ill patients. This air mattresses, they have this honeycombs which you can see there. They have this a device is there, which is that device which is hanging outside, and there the air is filled alternatively, so that at one point of time the pressure is not felt at the same place. And then nowadays this advanced technology is also there, where we have this mattresses with gel filled mattresses. The gel is on the top and the mattress is below. So it can be, this gel can adjust to the patient's contour and prevent bed sores. Side rails and trapeze bars, we all know what are side rails. The purpose is to ensure patient safety and useful for increasing patient's mobility, and to provide assistance in rolling from side to side or sitting up in bed. The trapeze bar is an overhead bar which the patient can use for raising or moving up in bed, or from transferring from bed to wheelchair, and also for performing upper arm exercises. Next is the footboard or the footrest. These are the mechanical devices used to give rest to the feet. It may be made of plastic, wood, or heavy canvas, or it can also be improvised with pillows. The main purpose is to maintain normal position of feet while bedridden and to prevent foot drop. I hope everyone knows what's a foot drop. Now coming to roll. Rolls can be trochanter rolls or hand rolls. Trochanter rolls is made up of bath blanket or a sheet which is placed below the trochanter and is rolled in counterclockwise direction. As you can see in the second picture, the roll is made in counterclockwise direction, and then the main purpose is to prevent the outward rotation of the hips and the thighs. Next is the hand roll. It is used for patients who are paralyzed or who are comatose. It keeps the finger free from being held in a tight fist. Next is sandbags. These are the sand-filled plastic bags that can be shaped to patient's contour and can be used either or in addition to trochanter rolls. The main purpose is to provide safe and support to the body and also to immobilize the extremities. Knee rest. Knee rests are devices which are placed under the knee to give support. The main purpose is to give relaxation, relieves pain on tendons beneath the knees, and also to improve leg circulation and provide relief from the discomfort of varicose veins, swollen ankles, and phlebitis. In that arrow, you can see, instead of this, we can use a velcros, and then that can be covered with cloth for using as a knee rest. Now coming to bed blocks, it's made up of wood or metals. It is used to raise the foot end or the head end of the bed. It is used to prevent shock, arrest hemorrhage, and to retain edema. These bed blocks can also be improvised with bricks, which can be covered with a rubber Macintosh. In home care settings, we can use bricks. Now coming to air cushions, rubber rings, or cotton rings, it is used to take off the weight of the body at sacral area and also to prevent bed sores. Splints and braces are used in trauma or overuse, injury, fracture. The main purpose is to promote tissue healing, reduce pain and prevent contractures, and improve the range of motions and also to correct deformities. Now coming to water bag, we all know what is a water bag, hot water bag. It is used to relieve pain and muscle tension, giving warmth to body and reduce inflammation. And then by adding cold water or ice in the bag, it can also be used as a cooler or a cold compress in case, for example, if the patient is having urinary retention, it can be used. The main thing while using a water bag we have to keep in mind is the standardized checklist, which we have to keep in mind, like how to fill a water bag. In this picture, you can see how we fill a water bag. We all know how to fill a water bag, right? Hot water bag. The air should be moved away, and then while tightening, we should always check it. We should put it upside down and check, and the water should be poured away from the person's body, etc. And then nowadays it comes with cover. Water bag comes with cover. Now, coming to the next topic, positioning. Why positioning is important in palliative care? Because most of the patients who are in palliative care spends entire amount of time of the day, if not the entire day, in bed. So this positioning is very important because it promotes psychological and physiological well-being of the patient. Purpose of patient positioning is to promote physiological alignment and also protection of skeleton and neuromuscular structures, and it prevents bed sores and contractures. It also provides patients comfort and safety, and also helps in stability and security in position. The patient will not slip out of bed or come to the edge of the bed. One of the most important aspects of positioning is log rolling, which I'll be demonstrating with the help of my colleagues. Now I call my colleagues Anil, Helena, and Rupalim to come and take the position, and Fretty to volunteer as the patient. So we'll be discussing how to log roll a patient with the help of 3 people. So I would like, since they have taken the position, Fretty is there, right? Okay. So we all are going to take control of the patient's body, that is Fretty. I would like to say to Fretty that, Fretty, you please be relaxed and then let us do all the work. Then I would tell the person who is in charge of the cervical spine to hold the patient's body. The person in the front will be in charge of moving the patient. Fretty, before that, I would like you to move your toes and fingers a bit to make sure that everything is okay. Done. So Rupalim and Helena, please reach out and cross your arms to take control of Fretty's body. And on the count of 3, you are requested to lock the bed. Lock the bed. Pretty, you can put your arms around your stomach. And on the count of 3, we are going to log roll the patient. 1, 2, and 3. So now it is the best time to check for any injury or bad sores, or if there is any linens to be changed, or to keep the linens free of linkers. So once it is done, we'll put back the patient back to the position with the count of 3. 1, 2, and 3. So this is how log rolling is done with the help of 3 people. It can also be done with the help of 4 people if there is any cervical injury. Thank you. So one thing we should make sure that when we are log rolling a patient, we should never hold the patient's clothes for gripping. And after log rolling, hand washing is required. Some of the positioning which is used in palliative care is supine or horizontal recumbent position, which is the most common with the least amount of harm. Spinal cord is in alignment with legs parallel to the body. Supine concerns are for circulation and pressure points. The most common nerve damage is the brachial plexus injury, which is caused by positioning the arm. If the arms are positioned greater than 90 degrees, then brachial plexus injury can occur. The safety consideration is that the head should be maintained in neutral position. The potential pressure points in supine position are the occiput, the scapula, the thoracic vertebra, the sacrum and the coccyx, the calcaneus bone, and the olecranon process. The comfort devices which can be used in this position are air or water mattresses, pillows, hand rolls, trochanter rolls, knee rest, and footboard. The next very common position which is used in palliative care is the lateral or the side-lying position. Here the leg is flexed at the hip and head must be in cervical alignment with the spine. Paddings or pillows can be kept in between the knees, ankles and feet, and the breast and the genitalia should be free from pressure. And in this position, the coccyx is also free. Pressure from the coccyx is also relieved. The lateral concerns are the pressure points, and common nerve damages are brachial, radial, median, ulnar and peroneal nerves. Safety consideration is maintaining spinal alignment during turning and padded support to prevent lateral neck flexion. The pressure points are the scapula, the ribs, the iliac crest, the greater trochanter of femur, lateral knee, and the lateral and the medial malleolus. Commonly used comfort devices are air water mattresses, pillows, knee rests, etc. Now, a stroke might cause paralysis to one part of the body, and the patient might find it difficult to move in bed. So, the positioning of the person in stroke is very much important, and we have to keep in mind that patients with stroke has to be changed frequently. Positioning has to be done frequently, at least 2 hourly, so that there will not be any damage to the skin, and it will prevent contractures and respiratory problems. The other thing, this is a positioning of a right-sided hemiplegia patient. So just before conclusion, I'll just want to show you a video on how to position a patient who is having stroke.
Lying flat on the bed. Head is in the earth position. Use towel to position the head centrally. Be placed under the weaker shoulder and arm. Ensure that the weaker leg is positioned in a neutral position and not rotated out. You can also use pillows to hold the leg in position. Lying on the strong side. Ensure that the patient is well rolled over onto her side. Ensure that the head is well supported and in good alignment. Place a pillow under the weak arm to support it. Place the pillow under the weak leg to support it. Lying on the weak side. Ensure that the weak arm is placed away from the body before turning the patient over. Roll patient on her side, allowing the body to rest back onto the pillows. Slide the weak shoulder forward to avoid excessive pressure over it. Place a pillow between the patient's legs. Sitting out on a chair. Ensure that the patient is not slouched. She should be sitting well back into the chair. Avoid leaning to one side. Place a pillow under her weaker arm to support it. Ensure that her foot is flat on the floor. If the chair is too high for her, you can place a footstool under her foot. Ensure that the weaker leg is in neutral position and not rotated outwards. You can place towels or cushions by the side of the leg to keep it in position.
So, just want to conclude that if we are alert, if as a health worker we are alert, we'll be able to know that the patient is uncomfortable, even before the patient himself realizes that he is uncomfortable. We as an alert healthcare worker will be able to know that, and as a result, intervention can be applied. Thank you.